For more than 15 months, living through a global pandemic has also meant living through an infodemic. False or misleading information, especially online, has often spread just as fast as any other outbreak. These days, much of that misinformation and hesitancy is around vaccines, something different groups of experts are tackling online, trying to separate fact from fiction.
I have spent decades studying misinformation, and holy cow, are we ever in it now?
And creating shareable content to answer your questions.
This was one of the most popular questions.
So tonight we want to hear from them, the science communicators, as we move toward a new phase of the pandemic. Samantha Yammine is a neuroscientist turned science communicator. You may know her as Science Sam online. And Tim Caulfield is a Canada Research Chair in Health Law and Policy at the University of Alberta. Samantha Yammine and Tim Caulfield, thank you both for being here.
Thanks for
having me on.
Samantha, let's talk about what emerged as kind of a big story yesterday. The government's advisory committee on vaccines saying that if you had AstraZeneca as a first dose, the preferred second dose was one of the mRNA vaccines. What did you think of the messaging yesterday?
I think it's that word preferred that we're seeing creep up again that might throw people off. It makes it seem like getting an mRNA vaccine for number 2 is the ultimate best, and if you didn't do that, you made a bad choice. And so while I think the advice to follow with an mRNA vaccine is good, I do want to remind people that if you didn't do that, and if you already got your second dose of AstraZeneca, that's not bad either, and it offers great protection. They're saying it's preferred because of other reasons, including the incoming supply of mRNA vaccines.
But Samantha, both of you guys are science communicators. I kind of feel for NACI, the advisory committee, in a way, because the evidence seemed to have shifted. And how do you handle complex scientific issues involving COVID when the data shifts over time?
This is the challenging bit. It's good for science. Science always follows consensus and follows evidence. And when we learn new things, it's necessary for us to then change recommendations and policies. That makes it challenging when we're communicating things on the fly. And I think while in their report, which is now over 170 pages, they include all that nuance, it doesn't always get translated in the fast communications that we usually receive day to day.
Tim, I asked some people on Twitter earlier in the week if they were looking for practical advice to handle vaccine-hesitant friends or family members, what sort of questions they would have. The good news is a lot of people responded and said they were looking forward to hearing advice from the both of you. And let me read one of the tweets we got from Stephen and Karen. Seems like many of us are surprised to find friends and family distrustful of vaccines, and we wonder how to discuss something we thought would never be an issue. Tim, what advice would you have for them?
First of all, have those conversations. It is really valuable. In fact, Ian, research tells us that hearing from a friend, hearing from a neighbor, hearing from someone in your community can be very persuasive, right? It's someone that you can relate to. So have those conversations. Number 2, you don't want to shame. You don't want to be angry. Sometimes it's hard not to be angry because you're frustrated about the situation. Don't be angry. You want to listen. So important. Not everyone's hesitant for the same reason. You want to be patient. I know this sounds obvious, but you want to be patient. People will change their minds right in front of you. Does that ever happen, Ian? What you want to do is you want to give them a path to credible information. And that might include, suggesting they talk to a religious leader or suggesting that they talk to a primary care provider. And the last thing I'll say, Ian, is the other thing you want to do. You definitely want to be empathetic. Tell them a story. Tell them about why you got the vaccine. Give them that pro-social message that you did it for yourself, but mostly you did it for your friends and for your community.
Yeah, it's good advice. I was laughing because, yes, how often do you have somebody who after 45 seconds suddenly goes, you're absolutely right. That's a great point. But you do
Never
give
happens.
Very good. Yeah, absolutely. Now, Samantha, I'm sure you thought about this. I wonder about it. What is it about vaccines in particular, and it's not just COVID, we've seen it for years before, that fuels hesitancy?
What's interesting about vaccines is they're a preventative medicine. They're something that you take before you feel bad. In fact, you take it so that you never have to feel bad or deal with a disease. It's easy if you're feeling some pain to take a painkiller medication. You want that bad thing to stop. But when you feel fine, to take something, the way our brains are actually wired to process reward, there's no immediate reward after you get vaccinated, because when it works, which they do, you stay feeling good. And that makes the whole motivation to get vaccinated, especially when there are so many stories and there's so much misinformation, it makes it a lot harder to make that decision.
There is misinformation on social media, there is meanness, and it gets a lot worse. And I want to talk to both of you about the personal toll your work has taken, the willingness you are to get out there on these issues during these anxious times. So I want to play a short clip first of Tim reading what you call mean tweets.
Tim Caulfield, a self-proclaimed mouthpiece for the mainstream medical profession, who never met a microphone he didn't like. You are a conceited, smug, smarmy, obnoxious ignoramus.
Okay, so you're having fun with that, but you know what isn't fun, Tim, is that you've received death threats.
Yeah, those are the nice ones. Those are the nice ones. It can be exhausting, and I know Sam feels the same way. You know, the good news, Ian, is there's this wonderful science communication community in Canada, and I really think that we need to take steps as much as we can to support that community. Look, I'm old, I've been at this a long time, my skin is thick, but we've got to bring in diverse voices, we've got to bring in more individuals. We know debunking works. We know that having these scientific voices out there makes a difference, and I really think we need to create an environment that can make that happen.
And Samantha, what about you in terms of the mean or even worse kind of reaction you're getting? How has that been?
It has not been pleasant. I'm not going to say that it's easy, but as Tim said, it is something, unfortunately, that you have to get used to. The worst part for me is that it takes time away from the work that I actually want to be doing. And so I just want to remind folks, when you are on social media, remember that those with malicious intent, those trying to spread misinformation, they are very organized. They go in swarms to weigh down people like Tim and myself. And so when you see content that you like, I need you to be just as engaged. And it also helps to boost our content in the algorithm so that they can persevere, as opposed to those ones spreading misinformation.
That is such good advice. You know, a few times I've been kind of gotten this onslaught of negative tweets on a topic, and once in a while somebody will actually support what I've said, somebody I don't know, and it feels so good. So I actually like your advice, and I suggest people do that in the case of, you know, when they see either of you or any of the other scientists get, you know, become the victim of that kind of online abuse. And thank you both very much for the messages that you've sent out.
Thanks.
Thank you.
Thanks for supporting it.